and welcome to our second Facebook Live of the semester. Today we're going to talk about taking control of your health. My name is Amy Jones-Timoney from the Offices of Public Relations and Strategic Communications, as well as Marketing and Brand Strategy. And today I'm joined by Corrine Williams and Hannah Sims. Thank you both so much for joining us. A little background about our guest. Corrine Williams is an associate professor in the College of Public Health, and she's also the acting associate vice president for student well-being in the Office of Student Success. Hannah Sims is the executive director of UK Healthcore, a centralized team of contact tracers, wellness connectors, and academic coordinators, and a whole lot more, who provide individualized response to COVID-19. Thank you so much for joining us, and let's go ahead and dive right in. If both of you could kind of just give us some background about what you do here at UK, that would be great, and we can start with you, Hannah.
Absolutely. So as Amy said, my name is Hannah Sims. I have been working with our Healthcore team for the past year. We stood up at the beginning of last semester a modern public health infrastructure that we're really that we think is helping us handle COVID-19 on our campus. Like you said, it includes contact tracers, but it goes beyond that. We have wellness connectors and academic advisors that are really hoping to address a student's holistic kind of well-being when they're affected physically by COVID-19. We know that there are lots of other things that go into play in making sure that they have the ability to continue to be successful both personally and with their academic pursuits. So that team has been working really hard and are continuing to serve our students, faculty, and staff through this semester.
Awesome. Corrine?
So in the Office for Student Success in my area, which is well-being, there are 5 units under that. And I'm hoping people are familiar with them, but they are the Counseling Center, the Disability Resource Center, Violence Intervention and Prevention Center, known as VIP Center, Financial Wellness, and then Campus Recreation and Wellness. And when you look across those 5 areas, we really are there to support students in truly their holistic wellness and well-being, regardless of what needs they may have. And I think about that both with our campus recreation, where they provide outlets in terms of physical health. We also have wellness coaches within that. Just lots of great resources that are really designed to help support students. And I always say on our team, we know that students won't be successful academically unless they are experiencing good health and well-being. And so we are trying to make sure they have both sides of that coin.
So, Corrine, how has the Office of Student Success and specifically services related to wellness and well-being changed or grown in the past, year and a half now in response to COVID-19?
Yeah, so I think it's been really fascinating to watch. I've been in this acting role since January 1, but I've been working with the team even before then. And I will say, like everyone else, we moved a lot of stuff virtually to help make sure students could still reach out to services they needed, that they could access individuals who they needed to talk to. The other thing and this actually started pre-COVID, and I think it just is a sign of UK really being on the leading edge of things. We had been working on increasing some of our key services. So as a result of that, for example, we got 2 additional consultants in the Disability Resource Center. One of the things that is sort of a unintended consequence of some of the mental health challenges people have been experiencing during this pandemic is that more students now need accommodations for various mental health challenges, and that affects our Disability Resource Center. So we've seen growth in that area, in addition to some of the other areas you would see in terms of counseling services requests for that.
It's so great that we've had those resources here for everybody. Hannah, turning a little bit more to Healthcore, tell me just a little bit more about what it does and kind of the services that you guys provide to both students and employees.
Yeah, the main goal of Healthcore is to make sure that our campus community has at their fingertips the resources they need to successfully navigate any COVID-19 situation, whether that be a positive diagnosis, trying to locate and become vaccinated, better understanding what resources are available for testing on our campus, or things very personal and case by case, like someone who is in a quarantine or isolation situation that needs to understand what they can do to stay caught up in their coursework. So we have team members who are focused on all of these different areas. Wellness Connecting is a big resource that our office puts a lot of time and energy into. We know that students who have to stay home because of a quarantine or an isolation situation are discovering that they have needs that they usually are able to take care of for themselves, but when they're quarantined or isolated, particularly quarantined or isolated on campus and away from home, sometimes those are more difficult to figure out how you're going to get your groceries, or we've helped students who need a specific calculator to do a certain kind of coursework, and they're quarantined or isolated, so they would have gone to get that for themselves, but they couldn't. So really anything that you can think of, if you yourself found yourself isolated or quarantined, I hope you never do, but if you did, think of all those things that would certainly come up and become issues that you would wonder, and maybe you have family or friends because you're here and you're local. But for many of our students who have come and moved in residentially, both in our residence halls and around our campus, they find themselves in situations where they might not have that support system to sort of get the other things that you need, Corrine has mentioned, to be successful. So we have a team of people who are trying to answer those questions and problem solve with students, faculty, and staff who find themselves in COVID-19 situations. So yes, we do the basics, we do the contact tracing, we do the isolation notifications and the quarantining, and that's all a very important part of our public health response here at the University of Kentucky. But I think what's really unique, and what I hope that Healthcore is bringing to our campus and making navigating this a little bit easier for our community, is all of the other opportunities that our wellness connectors, that our academic support connectors, that our contact tracers and our communications team can provide by way of just sort of the other unexpected needs that come up during a quarantine or isolation situation.
I think that's such a great point, because there are those things that a lot of people would never think about.
Absolutely. And you just can't predict what it might be when you find yourself in a COVID-19 situation. So we want students, faculty, and staff to have the ability to make the call and say, I have this need and I don't really know, and we're going to do our best to help.
One thing I would just add, and I will say I actually referred someone to Healthcore yesterday, is they're a great resource if you just have a question. Yes. Hey, this thing happened related to COVID-19 and I don't know what to do. And I want people to know that is a great resource. That
Absolutely.
If you have anything that pops up, even if it's not a specific need, it's really just in that question, they can help because they are the experts on this campus.
And COVID-19, we've seen over the course of a year how quickly things can change. And I think that's a very good point, Corrine, because it's hard to keep up with rules and CDC guidelines and state and federal regulations related to COVID-19. So thank you for making that point. Exactly. We're keeping up with it, so you don't have to. Give us a call if you just have a question and don't know, was this an exposure, or what should I do in this situation? We want to be there to answer those phone calls too.
I like that, keeping up with things so that we don't we don't have to, because it does change so much.
Yeah.
Kind of speaking of keeping up with things and trends, Corrine, what trends have you noticed over the past year and a half in terms of the wellness of our student population? And then what resources are we providing to kind of help navigate those? Yeah,
so not surprisingly, I think anyone who's been around any sort of media in the past few months has heard about, discussion around mental health and the challenges we're all facing. And I think one of the things that, and I've said this a couple of times to students, one of the things that I weirdly appreciate about this pandemic is that it's really allowing people to be open with their mental health challenges in a way that they weren't before. And so even if something preceded, I think because we've gone through this sort of collective traumatic experience, it's really creating some opportunities for conversations and people being able to admit, I'm not doing okay. And I want to always make sure students know it's okay to not be okay. That is great. Not great. We want you to be okay, but we're here to help you. And so just a couple of things. So I think that's one thing. We are noticing more people talking and identifying as having anxiety or depression. There's a couple of resources that we offer that I always want to make sure people are aware of, particularly for students. I'm going to focus on students right now, because in student success, that is who we are focused more on. One of the favorite things that I always try to mention is the Counseling Center does a series called Let's Talk. And these are every afternoon. There's about 2 hours each day. And it's essentially drop-in appointments with counselors. So they are either located at a physical location on campus or they've now switched. So it used to all be Zoom. Now it's a couple of days a week on campus and then a couple of days a week on Zoom. And students can just log in to the Zoom meeting and they'll be connected. There's a clinician there who's ready to talk to them. And it's not designed for in-depth counseling, but it really is just I'm not sure what to do. I have a question. And we have a mental health clinician there who can answer those questions and can start to direct students to the appropriate resource. It might be that they do need to come into the counseling center and be seen there. But it also might be that, for example, meeting with one of our wellness coaches or one of our integrated success coaches in student success would also be a good option for just helping that student with the challenge that they're facing.
That is great to know. I know that a lot of parents and students would like to hear that. So
I've actually mentioned it to a few parents, and I was like, I want you to know that your students do have this option. We also have the ability, our counseling center is located over in Mandrell Hall, just across Limestone. People can walk in. If they are in crisis appointments are available on a walk-in basis.
that's great to know. Thank you. Hannah, what recommendations does UK Healthcore have to help members of our community take charge of their health, especially during COVID-19?
Absolutely. So I would be remiss if I didn't start by saying seek out a vaccination. If you are unvaccinated and you have questions, we have some wonderful healthcare providers at the University of Kentucky, both in University Health Services and otherwise pharmacy clinicians who would be willing and open to talk to you about your options for vaccination. But that would be the very first thing that I would mention to our community to help keep yourself safe, but also protect our community as a whole and everyone around you. So vaccinations are our greatest resource right now to making sure that we're keeping our campus safe. But beyond that, I think resources that Corrine has been mentioning and that already exist within our student success unit are really important because we feel like we've got a good handle and we're working with students, faculty, and staff on the physical aspects of healing from or dealing with COVID-19. But I think it's really important that everyone understands that there are resources out there to help you beyond the physical effects and how you may be physically feeling. Things to help you keep, mentally well and physically well beyond, your symptoms and things like that. So look at if you're in a situation affected by COVID-19, whether you've been exposed or you've been diagnosed with COVID-19, make sure you're looking at your holistic well-being. Mm-hmm. We want you to treat yourself, treat your symptoms. We've got, University Health Services. Mm-hmm. If you're a student here and you're away from maybe your primary care provider, we've got a really good resource in University Health Services mm-hmm. with telehealth appointments and all kinds of opportunities there. Same goes for employee health in that same University Health Services system. But don't stop there. Make sure you're taking care of your mind and your overall well-being through a lot of the resources that Corrine has mentioned, and I'm sure we'll share a little bit more about.
Well, and you mentioned a big virtual resource that we have in terms of the counseling center. Are there any other virtual resources that you think our community needs to know about? Yeah, so we really have in all the areas in my unit, or all the units in my area, we really do have a virtual element. So if someone has experienced any sort of interpersonal violence, the VIP center is happy, and that actually they work with both faculty, staff, and students, can do a virtual appointment on demand. There's a couple of things that are hidden, not hidden, but I don't think are as well known. So I do want to mention that our campus recreation and wellness has done a great job of making group fitness classes available virtually. And what I love about this is it really does bring some of that physical wellness right to someone's living room. There isn't I know people sometimes complain about parking on campus. There isn't the necessity of, driving to campus parking. You can join a class and, from your living room or from wherever, which makes it a little bit more convenient. And I think taking that opportunity to have that physical activity can be really, really important. The Disability Resource Center also does have Zoom appointments available to students. So if you have a question or a concern, you can schedule and make an appointment and just have that initial conversation, that initial intake, and start to see what may be necessary if you think you might need accommodations. The last one I'll mention is our wellness coaches are also offering some virtual appointments. And that's a great opportunity for students who
are looking to improve their wellness a little bit and can work one-on-one with a coach, set a goal, and then have some planned activities to move toward that goal.
Those are some great resources, and I hope people will definitely seek those out. Hannah, we know that UK Healthcore was created to help navigate through COVID-19. What do you see as the future of Healthcore?
Yeah, that's a wonderful question, Amy. I think we've learned so much about interacting with our students and referrals to already existing resources that we have a really amazing opportunity to sort of take what we've learned through the pandemic and sort of accelerate out of COVID-19, with Healthcore hopefully being a part of that, taking really important lessons that we've learned about the ways our students want to engage with us and the ways that they find our resources, or more importantly, maybe aren't finding our resources. And how do we get better at that? How do we make sure they know where they are, they have instant access should they need them, or maybe even find our students who aren't raising their hands to ask for help and say, hey, we think this might be something that would really help you succeed holistically at the University of Kentucky. So I think there's a lot of opportunity to take what we've learned and the ways we've interacted with students, faculty, and staff through the COVID-19 pandemic version of Healthcore and really make it a kind of modern staple in our approach to student success moving out of COVID-19.
That's great. It's, you have to find some of those things out of the pandemic, right?
Yes.
That we want to be able to continue. So that's good to know. Last question, and I would love for both of you to answer this. Although our students have a much more normal, college experience this semester compared to the last couple of semesters, COVID-19 is still, front and center with this variant. And I guess for students who have some concerns about their health, their well-being, what advice would you give to them at this point in time?
So I think I would go back to something I said earlier, right? It's normal to have these concerns, and I think students are struggling with being very excited to be back on campus and have a much more normal fall, but also recognizing that we still have people in the hospital where, hospitals are capacity. And so there's this tension between these sort of really happy feelings and then this overall concern. And I think I just want to reiterate, it's okay to not be okay, and it's okay to seek help. One of the things that I'm hoping that we can really do, and I'm going to take Hannah's words as we accelerate out of COVID-19, out of this pandemic, is can we really think about a culture of help seeking where we normalize that and say that we are social human beings, we all need each other in some way, shape, or form, and it's okay to say, I just need someone to talk to, or I'm not doing okay. And it's okay when you run into someone, a friend, and you say that, hey, how are you? It's okay to say, actually, I'm not okay. Do you have a minute to talk? And just trying to normalize that and know that the Office for Student Success is here with a lot of resources. If students reach out to us, we will try to pair you with the best resource to help support you.
That's great advice.
And absolutely building on what Corrine just shared, you're not doing this alone. Whether it's a COVID-19 question that you're directing towards Healthcore, or you are asking for help in the form of one of these other resources that Corrine has mentioned, at no point in this semester do we want anyone, student, faculty, or staff, to feel like they're navigating these challenges alone. We've got teams of people in Healthcore and teams of people in student success and employee relations and human resources have the same sort of support infrastructure available for faculty and staff that student success does for students. And so at no point should someone feel like they are alone or are forced to navigate this alone. Healthcore is a good start if it's COVID related, or honestly, if you just have a resource connection question. We have worked intimately with units Corrine has discussed over the past year. So we want to be here. We don't want anyone to feel like they're taking on this semester alone. So ask questions, ask for help, even beyond Healthcore, professors and staff around the campus. We are so excited to have our students back, to be back here participating in a robust sort of in-person semester. And so just ask questions. People are eager to help. We're eager to have everyone back here together. And we want to do it right. We want to make everyone feel safe and like they can get answers. So ask questions, find help, call us if you need help, and we'll try to get you to the right resources.
That is great to know. Thank you both so much for joining us today. Your experience is invaluable to everybody here on campus, and we really appreciate your time. And thank you for joining us today for this Facebook Live. Have a great afternoon.